I'm going to discuss our paper, Deep Brain Stimulation of the Centromedian Nucleus of the Thalamus for Lennox-Gastaut syndrome, a systematic review and individual patient data analysis. Lennox-Gastaut syndrome is a severe childhood onset epileptic encephalopathy that represents a management challenge. Typical surgical options are corpus callosotomy and vagus nerve stimulation, but DBS of the centromedian nucleus of the thalamus has recently emerged as a treatment option. We sought to synthesize the existing literature on the effect of DBS of the centromedian nucleus of the thalamus on seizure frequency overall and of seizure types, identify complication rates, and stratify the patients for which DBS of the CMN may be useful. To do this, we conducted a systematic review using PubMed, Embase, and Scopus. We aggregated all search results, removed duplicates, and then screened first by title and abstract for relevance, and then by full text for inclusion and exclusion criteria. Then we extracted relevant data from the included studies. We also conducted a clinical trial review of DBS of the centromedian nucleus of the thalamus for Lennox-Gastaut using the clinicaltrials.gov database. This is our Prisma flowchart. We identified a total of 72 articles, and out of those, we included 10 in our review. So 6 out of 7 studies reporting a greater than 50% seizure reduction as an outcome indicated the greater than 50% of patients achieved this, but the rate of seizure freedom was consistently low across studies. In our individual patient data analysis, over 80% of patients experienced greater than 50% reduction in seizure frequency, but only 6.4% experienced seizure freedom. The mean seizure reduction was 62.9 plus or minus 31.2% overall. Quality of life improved in 88.2% of patients and was unchanged in the remainder, and the complication rate was less than 5%. This was all at a mean length of follow-up of 19.8 plus 26.1 months. In conclusion, limited data indicate that DBS of the CMN may be effective and safe for people with LGS, and future studies must characterize outcomes of DBS of the CMN in larger populations, compare outcomes with those other surgical modalities, corpus callosotomy and vagus nerve stimulation, and ultimately develop concrete treatment algorithms for the surgical management of LGS. Thank you.